This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new edition of Behind the Headlines. I'm Charlie Greenewalt, Senior Fellow of the Susquehanna Valley Center for Public Policy, and I'm joined as usual by my co-host, Maura Donnelly. Welcome, Maura.
Hello, Charlie.
Well, we're in presidential primary campaign season.
I thought you were going to use the word chaos for a minute.
But that is a very good analogy. What is going to happen in Pennsylvania? Who's going to win Pennsylvania?
You know, I feel really badly. I wish our primary was a little bit earlier because then we would have more of a role. I think that the field is going to be a lot lighter by the time it gets here, but it's looking like it's going to be
Those are your Democratic roots showing there because of, remember, Governor Rendell wanted us to have the first primary in the nation, forgetting the fact that New Hampshire has a state constitution that says they have to be first.
I don't think we have to be first, just earlier would be nice. So it's going to be an interesting month or so before we get there.
It sure will be. Today, to talk about politics at the local level and what's going on in Pennsylvania, we have Dave Sanko, who's the Executive Director of the Pennsylvania State Association of Township Supervisors. Dave, welcome back to the show.
Thanks for having me.
Well, Dave, there is a lot of things. Things are in ferment in Harrisburg, to be sure. And we find that recently the governor, for example, has proposed a $33.3 billion budget for 2016-17, when, of course, we don't have a budget for the prior year yet. And you find that this budget, is it going to affect the impact fee? The governor is calling for a severance tax on the fracking industry. But if that, in fact, would be imposed, Dave, would the impact fee that the industry pays now to local townships go away? How would that work?
Well, the current law, Act 13, as it was passed in 2012, would require that if there was ever a severance tax, that the impact fee would go away. And the governor proposed a severance tax in his last budget, which is the first of the two budgets that are on the table now, and it didn't make its way into the final mix. He's proposing it again. It appears as though has become sensitized, and the legislature has become sensitized to the good value that impact fee has generated for communities all across Pennsylvania, and there seems to be an acknowledgement of an intent to preserve the funding for the impact fee, and in fact maybe even give the industry, the company, actually tax credits for the impact fee that they pay against what their severance tax could be.
So is it a hybrid? Would be kind of like a hybrid? Because right now the impact fee goes directly to the communities. The severance tax would go into the general fund, correct?
Yeah.
And wouldn't go directly to the communities.
And that is the huge difference. I mean, everybody says, what's the difference? A tax is a tax, and a fee, a tax, it's all the same. The difference is, who do you trust to spend the money? Right now, the impact fee was set up so that it goes to local communities, and local communities spend the money. The severance tax money goes to the general fund, and if you're paying money, and do you trust your local community, or do you trust Harrisburg to spend it?
And Dave, which would end up being bigger? Which would end up being larger? What would the two be in terms of size?
Well, I think it depends on where they set what they set the rate at. The impact fees have been generating around $200 million plus or minus. Given the current market rate of gas, it's a little bit lower. This year it'll only generate about $188 million, so it's down 12 million from the 200 million mark, and that's actually the high water mark was about 215. So, I mean, there's been some fluctuation, but local communities are comfortable with that. And there was some talk last year about having a locked-in 200 million figure, and our members have pretty much said, we'll ride. It's like riding the market. If it goes up, we win. If it goes down, we lose. We're not looking for any guarantees or handouts. If it goes down, we'll figure out how to get by on less.
Well, speaking of the who do you trust issue, we've got some interesting things happening with the Motor License Fund and the funding of the state police. So could you talk a little bit about that, especially tell our viewers why this is an important issue to the townships?
Well, I think, recently the legislature passed Act 89, which was a a landmark infusion of funding for transportation projects. I mean, there are billions of unmet needs in transportation. Pennsylvania leads the country in structurally deficient bridges. Not something to be proud of. So there was a big effort to try and fund some of those projects. They're not fully funded. That money wasn't enough to fully fund, but it becomes even more difficult when some of that money that was intended to fund transportation projects is being siphoned off to fund state police, because the governor and the legislature have not been willing to pay for state police out of the general fund.
Well, it turns out that 25% of the Pennsylvania State Police budget comes from the general fund, 75% comes from the motor license fund. There are some people that are saying municipalities should pay for this. What do you think?
Well, I think on balance, the state police in Pennsylvania has the oldest state police in the country. They were created in the beginning to provide public safety and security for all communities in Pennsylvania, and they do that. And there are other communities that, by virtue of individual demographic demands or crime rates, that they say, you know what, we want to put a local police department on. So there are communities that have, everybody gets state police. There are other communities that have added on a local layer of police as well. Some communities in rural parts of the state that simply don't have a crime rate and don't have a need or have a capacity to pay for a full-time police department, and are perfectly satisfied with what was intended to be the case, and that's for the state police to patrol. And state police does that. State police don't enforce any local ordinances when they do that. They simply enforce state laws.
So the issue really isn't whether or not the state police should be funded out of there. It's really to what level or to what degree, correct?
I think that it is reasonable, and folks need to figure out what portion, what the number should be. We've seen, and there is an amount that should come out of, it would be safe to come out of the motor license fund, because you are patrolling roads and you are dealing with safety. But we've seen that number go from $300 million up to this year over $800 million, which is a huge increase. And I mean, take a look at the numbers. There aren't really any more troopers today than there were then.
Well, that's what I was just. Go ahead.
No, so what you're really looking at is what's driving those costs, and just like many other areas in state government, the costs of state police are being driven by their pension costs, and their pension costs are spiking through the roof. So that's being passed along to now coming out of the failure to address pension reform in Pennsylvania is resulting in more highway safety issues.
Well, that's what I was going to ask a moment ago. Have the townships ever had the opportunity to sit down with the governor, with the state police, with the legislative leadership, and say, what if the state police are responsible for patrolling all this extra area? What is the proper size? What should the proper size of the state police be? Is the force truly large enough at the current time to handle all these responsibilities well, Dave?
Well, I think the force has grown over the years. Post September 11, there were some additional troopers that were put on for security-related issues at nuclear power plants and stuff like that. There were additional troopers that were added after gambling came into place, and they do policing in gaming areas. There were a whole bunch of troopers that Governor Rendell directed out of the state police into patrolling the city of Philadelphia. And doing interstates there. So there are a whole bunch. There may be less troopers on the road in rural communities, but it's not because there are less troopers overall. They've just been assigned to do other things.
So we can't help this time of year but talk more about the budget. We still have last year's to deal with. We have a new proposal. How were townships impacted by the stalemate from last year, and what are some of the ongoing issues that townships are facing because some things are not resolved yet?
Well, in this book that I like to call A Tale of Two Budgets, we find that the good news and bad news of the historical practices of unfunded mandates that have come from Harrisburg on township governments is because all the mandates were put into place, there wasn't money sent along to do those duties. So when they cut the money off, it didn't hurt, because nothing from nothing is nothing. So there wasn't a huge impact to local townships, unlike school districts, unlike counties and human services providers.
Who saw actual cuts.
Who had to go out and borrow money to
Right.
continue to provide the services. The municipalities have always had to live on shoestring budgets and have figured out how to do that efficiently. Lessons that could be useful in Harrisburg and Washington.
Yeah.
At the height of this budget crisis, Dave, Governor Wolf decided to use his line item budget veto powers, and he cut the Public Employees Retirement Commission, and that's generated some controversy, to say the least. There have been some new developments in regard to this in the last week. Could you fill us in on what you know?
Well, the Public Employee Retirement Commission is the entity that's responsible for assessing all the pension funds in the state and figuring out what portion of state aid will go to those. So municipalities will get state aid to help offset some of those pension costs. This was the group that would identify what the amount of that state aid would be, and then that money is allocated out through Treasury. Our concern was that again, in the state's failure to address pension reform hasn't been having a huge impact on local municipalities, because most of the local municipalities are well funded. But absent that state aid that has historically been there would become problematic. So we were concerned that those services continue to be provided. Auditor General DePasquale stepped up and offered to provide those services in the interim, so that municipalities would be held harmless and not feel any interruption in that flow of funds. And then more recently, there was there's going to be a court hearing in May to finally decide what happens with that. But for now, everything's kind of on hold.
Okay.
So it's going to be okay, but it's just
I think that local municipalities are going to be okay, and the state aid will continue to flow, and the courts will decide who ultimately is going to be moving those levers and writing those checks.
Can you guess why there would be a cut to this commission in the middle of a pension crisis in the state?
Well, I think the commission.
Or speculate.
Yeah, the governor contends that the commission duplicates the effort that are put out by the individual pension entities. The retired state employees, retired teachers, each have their own actuaries to come up with reports. This commission was there to do an independent actuary review, and I guess there are some times when you may question what accountants come up with, but actuaries are pretty straight-laced guys, and I don't know of any of those that are playing with the numbers.
Right.
So I'm not sure that there may be some duplication in that, and the governor may be right.
Oh, okay.
Dave, in the last 15 seconds, how in the world do you, as the head of this association, handle yourself and your association's dealings on Capitol Hill when we are talking about a new budget and we don't have an old budget? This is so uncharted waters, isn't it true? How do you deal with a situation like this?
It is. It's challenging. It's unfortunate. But I've talked with some of my colleagues who have worked in Washington over the years, and they go years and years and years without budgets. I hope that Pennsylvania doesn't discover whatever the Pennsylvania equivalent of a continuing resolution is, and that we, can again act responsibly and do what the residents expect us to do, and that's live within our means. But it's an election year, so stay tuned.
Yeah.
There are more and more parallels between President Obama and Governor Wolf, perhaps. It's perhaps a good book subject sometime. Dave, thank you very much for coming in.
Thanks for having me.
Okay. We'll be back with the second segment right after this. Stay tuned.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The council works aggressively to define key long-term policy strategies and solutions to make the commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States. And by Blackford Ventures, LLC, a private equity firm seeking to make significant investments in real estate, proven business enterprises, and their leaders. Find out more at www.blackfordventures.com. And by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Please join NFIB on April 4th and 5th for our Small Business Day at the Capitol. Our two-day event kicks off with seminars and speakers with high-level policymakers from Pennsylvania. It also includes a dinner with our featured speaker, Stephen Hayes, who's a commentator on Fox News and writes for the Weekly Standard. It concludes with an all-important day on Capitol Hill here in Harrisburg.
Welcome back to the second segment of Behind the Headlines. And before we begin this segment, Mara, the one thing, we talked a little bit about the presidential primary at the beginning.
We did.
The other thing that we should note also, I think, is the passing, unfortunately, of Drew Lewis,
Yes.
A great Pennsylvanian and the former Secretary of Transportation under the Reagan administration and a Republican gubernatorial candidate back in 1974, I believe. But he will be missed, and one of the most successful businessmen in Pennsylvania's history. So it's a shame to see him pass, and we wish him and his family only the best. We hear, as the presidential primary continues, we hear lots of talk about Obamacare and
Yes.
what's the future of Obamacare and the future of hospitals in America. And who better to talk about that than Andy Carter? Welcome back, Andy. You are the president and CEO, of course, of the Hospital and Healthsystem Association of Pennsylvania. We're so delighted to have you back. Can you tell us sort of what is new with your association and what you're doing on Capitol Hill when we have this? It's not that we don't have a budget, but we have an incomplete budget.
We do.
How does that affect you and your association?
Well, it is a shame. It is an incomplete budget, and it includes the fact that unfortunately, the governor vetoed 3 lines that are very important to hospitals, including support for our critical access hospitals, of which there are 14 across the state, and they provide essential healthcare services in our most rural communities. So discussions are underway to get those dollars restored. So we do look forward to resolution as soon as possible. Meanwhile, of course, the work of hospitals has to continue, and I'd say that we're trying to move the ball down the field a bit in several areas, even while some of these financial matters are still under discussion. First and foremost, we do want to continue to maintain the investment in healthcare, and that's what the budget's really all about. And we have to, in some ways, strengthen that investment. But there's a second and third area that we need to work on too. The second area is doing more to reduce some of the red tape that makes it harder and harder to be efficient and to achieve the goals that we all set for our healthcare system. And then the third part of our strategy to keep moving forward is to do more to unleash the great potential in all our physicians and nurses. And there are a number of things that we can do to make that happen. And that's actually an area of particularly intense focus right now. So
can you give us some examples of how you're going to keep them here?
Well, I'll tell you, it's always it's a challenge.
Yeah.
We, for example, on physicians, we are one of the 4th largest producer of physicians coming out of medical school, but we rank 37th in terms of the numbers that actually stay in Pennsylvania.
Oh.
So that's just a quick piece of evidence that we have our work cut out for us, and there are things we can do there to make practice here a better environment, everything from medical malpractice reform to make it easier for them to work with insurance companies. And that's a whole different conversation. When it comes to nursing, there are steps we can take. And one of the most exciting steps, and I credit both Senator Pat Vance and Representative Jesse Topper for their leadership in trying to make it possible for what so-called nurse practitioners, sometimes called advanced practice nurses, to practice to their full authority in their training. Right now, under Pennsylvania law, they have to operate under the supervision of a physician and have a collaborative agreement. And that really impedes their ability to do as much as they can and as much as they're trained to do. So we support legislation led by Senator Vance and Representative Topper that would allow them to practice to the full authority of their license. Now, we agree that some degree of supervision at the beginning is appropriate, and we're working on language to figure out what amount of supervision before they're able to be fully on their own. So that's a critical priority, because we can really leverage what they bring to the delivery system. You know, we face a growing demand for primary care services. We have almost 1 million more people covered through the Affordable Care Act, the federal marketplace.
Like it or love it, there's a lot more people insured.
Exactly. Yeah. So what we're dealing with is that fact, that
Well,
between 900,000 and 1 million people.
Well, we're talking about one of the features of Obamacare was the access to health services and to hospitals, and this must be a major concern of hospitals now, isn't it, in terms of the access?
Absolutely. We've supported the expansion of coverage. That's essential, but we have to not stop there. We have to make sure that they have access to clinical professionals. And not only is the number of insured folks growing, we now have uninsurance has been cut dramatically from 14% uninsured to now only 8%. But we have to recognize the fact that we're an older state. You know, we rank 4th in the nation with the proportion of Pennsylvanians who are over 65. And as we get older, our demand for primary care services increases. So we really need to take steps to make sure we count on and have in place enough primary care providers. And by being able to have these nurse practitioners free to practice to the full scope of their license, we can meet that demand in the coming years.
As someone who has an aging parent who's spending a lot of time in the healthcare system in Pennsylvania, one of the things that I've noticed is two observations. Nurses are phenomenal. They tend to only make headlines when something goes wrong, but there are so many phenomenal nurses out there. And I'm noticing more men are getting into the nursing profession, which I think is phenomenal. Is there anything geared towards trying to attract more gentlemen into the field going on? Because it seems whatever is happening is working. And if we're looking for skilled nurses, that's a pool of people that haven't traditionally thought about that as a career path.
It's clearly evolutionary, and here in Pennsylvania, I know hospital leaders and nursing education leaders are doing what they can to make it an appealing profession across the spectrum, men and women. We do take very seriously our responsibility to have a workforce that represents the diversity of our patient population. So across gender, race, ethnicity, these are all important objectives to make sure we're delivering the care that people want and need. Now, I do know there's a controversy brewing around nurse staffing. When you mention items popping up in the news, we hear occasionally concerns around whether or not we have adequate staffing. So there has been interest in legislation to require everything from specific nursing to patient ratios, to legislation that would require creation of committees that make decisions that are imposed on the hospital. And we support an alternative approach to making sure that we have safe staffing at our hospitals. And the number one thing we can do to ensure that is to hold hospitals, as we are doing now, accountable for good results. And that's what the state is in a good position to help patients and families do, which is, are we treating patients appropriately, safely, discharging them successfully so they don't have to come back for any redos? We should keep a laser focus on the results of those the care we provide, rather than attempting to tie the hands of hospital leaders with rigid ratios or bureaucratic requirements that will never keep pace with the rapid change in hospitals. And, you know, taking care of patients is a very dynamic exercise. Maura, from your experience with your father, you knew that different kinds of clinical professionals are coming and going, working together as a team
and night.
All day. And the idea that you can impose strict, immovable ratios or a bunch of bureaucratic requirements that they would succeed in making sure your dad got the right care, that really doesn't respect the professionalism of the nurses, the respiratory therapists, the physical therapists, and the physicians who have to work in a very dynamic way together, rather than looking over their shoulder at a rule book that isn't responsive to the needs of the patient.
Well, with Obamacare providing perhaps access for more individuals, Andy, and with our graying population, as you said, and the increased need for seniors to access hospitals, is your association supporting specific legislation on Capitol Hill here in Harrisburg to address or deal with this access issue at all?
Well, we're certainly supporting adequate resources to ensure that our hospitals are operating at full capacity. In terms of other legislative strategies that we want to do to make the workforce be effective, I'll give you another example that to help doctors get online quickly. After they become licensed, they can go through a 3 to 6 month process in Pennsylvania before they can get so-called credentialed by an insurance company and begin getting paid for health care. So there's red tape that they don't need to be able to hit the ground running. So we do support legislation that would, we call it credentialing reform, that would standardize the process by which insurance companies approve a physician to be part of their network, and require that at least provisional credentials be issued within 30 days. Now, of course, we wouldn't want anybody credentialed who wasn't licensed and competent as a physician. But this lengthy bureaucratic red tape process has to be standardized. And if we get folks online within 30 days, we'll be much better off. And that's one less hassle factor for physicians.
And so when you say get them online, what are you exactly referring to?
Yeah, being able to treat a patient and submit a bill for reimbursement.
Oh, okay. I thought you meant get onto the internet. So I wanted to make sure we clarify how you're using that term for our audience. So speaking of getting online, there are a lot of changes coming. There are some requirements that certain things and certain information be captured into databases directly, and there's a lot less paperwork for doctors. How are you? I imagine you're continually trying to modernize what you're doing within the hospital systems.
Absolutely. The whole healthcare community knows we have to move from paper records to computerized records. It's a long journey. Physicians note that, and nurses too, that it's complicated to try to treat a patient and enter data into a computer at the same time. But we're working through that process. Moving away from paper records creates another opportunity for us to exploit the potential of telemedicine, something that in Pennsylvania we don't exploit as well as we could.
And we're very rural. That might come in very handy, especially when you're talking about access. Telemedicine might be really critical to some of the northern tier areas where access is very limited.
We have to make it possible for people who are, as you say, more remote from specialists who are typically located in urban centers, make it possible for them to get access to that expertise. And we are 30 states require insurance companies to pay for telemedicine services if they would also pay for it as a face-to-face encounter. Pennsylvania is not yet one of those states. We'd like to see it become a state that pays for telemedicine.
And on that note, we've run out of time. I'm so sorry, Andy, but thank you very much for joining Maura and me today. We look forward to your next visit, and we look forward to seeing you again next week, right here again on Behind the Headlines. We'll see you then.